Crisis Services, this is Andrea. How can I help you? Hi. Oh, I'm so sorry to hear that. Can I ask what's going on?
It's such a sacred thing for someone to let you into their suffering. And it's a gift for me if I feel like I'm helping even just a little bit. So I'm providing that safe space and providing support, and I feel like that is helping set someone on the path to healing. Early, mid-60s, my Uncle Joe and his siblings and their spouses were really active in the local mental health community in Western New York. Joe began to see that there was a need to help folks that were feeling suicidal. And so he had the idea of starting a suicide prevention center, a hotline. So he went home to his wife, Diane, and said, hey, can we just do this ourselves with the resources we have, which were limited. So they rented a room on Main Street in Buffalo, and the first suicide prevention center was born.
In 1977, it was pretty soon after New York State started to discharge individuals from state psychiatric centers into the community, and in many cases fending for themselves. So our job was to try to stabilize the situation and get those individuals linked back with the necessary supports through the mental health system.
With one number, you call in and you get the help that you need, and it's 24 hours a day. We're truly the safety net for this community, that with one phone call, you can get support, you can get guidance. Through our 55 years of service, though, we've expanded to that crisis response in the community work that, when we first started was strictly a hotline work.
Right, no, absolutely. You did the right thing by calling us today.
I make sure that you're safe. I make sure that you are in a space mentally where you will be able to get off the line with me and kind of follow the plan of your day. Then I'm comfortable and confident that I've actually done everything I need to do on this call with you, and now I'm handing you off either to other experts or I'm giving it to you as now you're the expert and you're able to handle your life after we hang up the line.
We have responded to the Tops shooting. We were right on site within hours of that happening. Mobile outreach in particular, again, are going out to seeing people who are at their worst. They are going into their homes, they are going onto the streets, and they are working with these people to diffuse, de-escalate the situation, and see what steps need to be taken in order to keep that person safely in the community.
The Advocate program specifically, we're a very niche sector of the work. We are the only rape crisis center in Erie County. We specifically work with survivors of domestic and sexual violence. I think what makes Crisis Services one of the most comprehensive crisis centers is not only that we have our 24/7 hotline and that we have our emergency mental health response services, but that we're also a part of this organization offering those niche services to survivors in need.
It very quickly became apparent that Joe and the other folks had to seek out donations from the community to keep the operation going. And Joe used his salesmanship and charisma and went out there and started to get donations. And that really helped sustain it.
We had a lot of different support to keep us afloat every year, but it is a puzzle that we have to put together to really support the most critical service in our community.
Through all the programs that the organization offers, Crisis Services saves lives. That was the case 55 years ago. It is the case now, probably exponentially increased. So this organization saves lives.